Hello and Assalamu alaikum, ladies and gentlemen. Welcome to another episode of the Dental Talk. As always, if you like our videos, please share, please subscribe, please like our videos. We are loving the support that we're receiving. Moving on to our guest tonight, ladies and gentlemen. Today, ladies and gentlemen, we have Dr. Tucker here with us, Dr. Myron R Tucker. You've heard the name. If you're a Pakistani dentist, probably a dentist from another country as well, you probably read his book, studied his book in final year of BDS while studying oral and maxillofacial surgery. He's the author, one of the authors of the book Contemporary Oral and Maxillofacial Surgery. And I tried remembering his introduction. I could not, as always. Not as always, he has a pretty massive introduction. So I'll have to read it out and you guys will have to bear with me. Okay, so Dr. Myron R. Tucker received his dental degree from the Baylor College of Dentistry in 1976. That means 46 years of experience in dentistry. He completed his oral and maxillofacial surgery residency at the Medical University of South Carolina. He was a full-time faculty member at the UNC and UNC Hospitals from 1982 to 1992, where he was the director of the graduate education in oral and maxillofacial surgery. He was in private practice in Charlotte, North Carolina for 18 years and has recently retired. While maintaining a private practice, he held academic appointments such as the adjunct clinical professor of oral and maxillofacial surgery at the Louisiana State University Medical Center in New Orleans, LA, and the University of North Carolina at Chapel Hill in oral and maxillofacial surgery and the Department of Orthodontics. Dr. Tucker is a diplomat of the American Board of Oral and Maxillofacial Surgery and served as an examiner and section chairman for the ABOMS board examinations. Dr. Tucker is an editor and co-author of 8 textbooks on oral and maxillofacial surgery. These textbooks have been widely used throughout the United States. We all know that. They have been translated into 7 different languages. He has also written 40 chapters in 11 other books, ladies and gentlemen. And Dr. Tucker has been very active in clinical and science-based research. He has over 60 publications to his name. He has lectured extensively both nationally and internationally, over 500 invited lectures. That is huge for a dentist on many subjects, with his main focus because he has revolutionized orthognathic surgery, and that will be a major part of our discussion today. And Dr. Tucker is currently involved in several educational and consulting activities and is the scientific head for the Osteoscience Foundation in America. So, ladies and gentlemen, 45 years of experience. He's authored so many books, so many years of research. I'm sure whatever he has to say, you guys will learn a lot from him. So, without further ado, ladies and gentlemen, it is my utmost pleasure, my utmost honor to introduce Dr. Myron R. Tucker. Hello, Dr. Tucker. How are you?
I'm fine. Thank you so much for contacting me and having me participate in this interview.
No, sir. I would like to start off by saying it's how big of an honor it is for me to be interviewing you, to be talking to such a huge maxillofacial surgeon out there. And since this book here is studied all around Pakistan and many other countries as well, it's an absolute honor, and thank you so much for taking time out for us. It really means a lot to us.
Well, great.
All right. So with your permission, should we start the interview?
Certainly.
Okay. So, sir, let's talk a bit about you initially. I know majority of the people who are watching this interview already know you. But if you could just introduce yourself to our audience, tell us a little about your journey through dentistry. When did you decide you wanted to be a dentist back in the early 1970s, I assume? And how was that journey through dental school in that age and time?
Yes. So I started college in 1969 at Arizona State University. I was a gymnast on a gymnastics scholarship.
Okay.
But I was a pre-med major and thought I wanted to do some kind of medicine or dentistry. Mm-hmm. And there was a young man in my dormitory who was at the end of my freshman year. He was mandibular prognathic, had a very deformed face, and quite, not very good looking. And when we came back to school in September, I didn't recognize him, and his face was all normal, and he was a handsome young man.
Yeah.
And I asked him what had happened, and he explained to me that he had this procedure called orthognathic surgery.
Okay.
And that, to me, was the pivotal event. So when I decided that I wanted to go into dentistry or medicine, I knew that I wanted to be an oral and maxillofacial surgeon, because I thought that was such an incredible transformation of a life.
Yeah.
So I went from there to dental school at Baylor College of Dentistry.
Yeah.
And from there, I did my residency at the Medical University of South Carolina.
Yeah.
Then I went into academics, and I was head of the residency program in Chapel Hill at the University of North Carolina for almost 12 years.
Wow.
And then I went into private practice for 17 years. And during that time, I had academic appointments and always had residents with me. I actually had to stop practicing a little bit early because I have a vision problem. I'm not going blind, but I just started having some blurred vision. And so now I work for the Osteoscience Foundation, funding a lot of research in the United States, and now we're expanding globally. But that's kind of my journey to where I started and where I am now.
That is an amazing journey, obviously, because you're at the top of your career. Absolutely. Okay, so if we talk about your early years as a dentist, who were those dental professionals earlier on in your career who had a positive impact on you as a mentor, and how important were those mentors during your journey?
Well, the chairman of Oral and Maxillofacial Surgery at my dental school was a professor, Dr. D. Lamar Bird, B-Y-R-D. And if there was ever somebody that emulated one of those aloof kind of professors that was just so far in a different world than everybody else, he was almost like a movie character, very charismatic and very just energetic about everything that he did. And if you had any interest in surgery and you spent any time around this guy, you just wanted to do that. And so he was an incredible inspiration. A lot of people thought he was just a little bit over the top kind of just bigger than life personality, but he was a very, very kind man. I was an IV technician in the hospital as a part-time job during dental school. And as up there as he was, if he would see me in the hallway, he would say, come with me. I have an interesting patient to show you. And he would spend a half hour with me, just me, showing me the surgery that had been done. And he was an incredible influence. And then my residency program director was a guy named Dr. Richard D. Champlain. And when I went to University of North Carolina, Dr. Ray White, who is obviously widely published in the dental literature, and a guy named Bill Terry, both of them were incredible mentors to me. So those are the four people in my professional career that had the biggest impact.
That's amazing. That's amazing. Okay, so we know you did your postgrad in oral and maxillofacial surgery. You've already answered this question, that why you ended up choosing this field. But if we had to talk about what are your views on other fields of dentistry, what would they be?
Well, that's a very interesting question for me, because a lot of oral and maxillofacial surgeons have this dental background, but they decided that they didn't like many aspects of dentistry, and that's why they migrated towards surgery. I started out knowing that I wanted to do surgery.
Absolutely.
But I loved every aspect of dentistry. When I was in dental school, I loved pediatric dentistry. I loved making dentures. Most people hate making dentures and removable prosthodontics, but I thought for a minimal amount of money and the amount of time a patient has to spend in the clinic, you can really impact on a life by making somebody a nice set of teeth. And
Absolutely.
so I love that. I did for a very short period of time consider orthodontics, which obviously is closely tied to oral and
Absolutely.
maxillofacial surgery. And so I'm one of those people that I liked everything in dentistry. I just like
Beautiful.
oral and maxillofacial surgery a little bit more.
Beautiful, beautiful. Okay, so sir, you've been in dentistry for approximately 50 years now, and that is a very, very long time. That's basically half a century almost. And so you've obviously seen dentistry and specifically maxillofacial surgery change exponentially over the years. What are those major changes that you've seen in dentistry? It's obviously due to technology, but is it amalgam, the change of amalgam to composites, dentures to implants, newer techniques for surgeries, guided surgeries? What are those major changes that you've seen in dentistry over the past 50 years?
Well, let me ask you this question, Mohammed. How old are you?
I'm I'm 23.
What year were you born?
1997.
Okay. So I started my surgical residency in 1978.
Yeah, absolutely.
We did not have computers.
Yeah,
We did not have cell phones.
absolutely.
So, it's not like I was in the dark ages, but for me, obviously computerization and the way that we plan things and what computerization has allowed us to do through imaging and CT scans and cone beam CT scans. As you said, the transition from removable prosthodontics to be able to make affordable fixed or at least hybrid prosthesis with implants has been incredible. The materials going from amalgam to composite in oral and maxillofacial surgery, going from the need for autogenous bone grafts to be able to have allogeneic bone grafts or xenogenic bone grafts. You just take it out of a bottle and graft it in there. The way we've been able to impact outpatient treatment. Patients for orthognathic surgery used to come into the hospital the night before surgery. We would do an operation. They would stay 2 or 3 days. They would have their teeth wired together and they would go home and unwire their teeth 8 weeks later. Now that surgery, they come into my office at 7:30 in the morning. They're back home at noon. Their jaws are never wired together. They're back at school on the following Monday. So we've taken a huge operation and made it something pretty minor. So I think in general, we've taken the complexity of a lot of these treatments and made them very, very easy for patients. Sometimes the downside of that is sometimes that's involved with some increase in expense. Technology is expensive, but overall better for the patient.
Beautiful. Okay. So, sir, even after doing your postgrad in surgery back in the day when such postgrads were really, really scarce, you went into academics and you were an academician for a very good period of your life as a dentist. How has that experience been? How has that experience been as an academician who has trained so many dentists either directly or indirectly through your books? And what would you advise to today's dentists to either go into private practice or go into academics? How has that experience been?
Well, I was a formal academician in an academic institution for 12 years.
Absolutely.
But when I moved into my private practice, we were still a very academic center. I had several other partners, and we had residents with us, postgraduate students. We did a lot of research. We obtained a lot of grant money. So I like to think of myself as, even at the time I was a private practitioner, I still had a very academic career. But if you just boil it down to one or the other, academics it's so fulfilling in two ways. One is when I left my residency program, you know a lot, but you still have a lot to learn.
Absolutely.
And when you go to an academic center, you're surrounded by other people. And so even though I was teaching people, there were a lot of people that were teaching me every day,
Yeah.
all day long. And if you're in private practice, particularly if you're by yourself, you're in a little bit of a vacuum. And so
Yeah.
you miss that.
Absolutely.
But when I went into private practice, I was very intent on continuing to do many of the academic things. I think we're in our 8th edition of that textbook, and we wrote the first 2 while I was in academics, but we did 6 more editions since then. Wow. And I've also written 3 other different textbooks while I was in private practice. So I still did a lot of academic things, even though I was in a different environment.
Okay. So now that you've mentioned the book, let's talk a bit about the book. We have to talk about this book. This book that you wrote is basically considered gold standard for oral and maxillofacial surgery, at least in our country, especially in the final year of dentistry. So what made you author a book of this caliber, and how was that journey of compiling this book, and did you have to face any struggles while compiling it?
Yes. When the book originally came out, there were 4 authors. It was Larry Peterson, Jim Hupp, Ed Ellis, and myself. Larry Peterson was a good friend of one of my mentors, and he felt like I was an up-and-coming researcher, academician, and he really gave me my first opportunity to put myself on the map by being part of this book. The challenge is that if you're going to write a chapter on a particular subject, and let's just say orthognathic surgery, you really need to know everything about it.
Absolutely.
And so for every chapter, you take the orthognathic surgery chapter, it might have 40 references of different articles or books that I've read, but I probably read 300 or 400 different articles to pick those 30 or 40 to reference. So if you imagine that book, we've basically divided into thirds. And so if there are 33 chapters and I'm in charge of 11 of them, and for each of those 11 chapters, let's say I read 200 articles, that's 2,000 articles.
2,200,
Every 5 years we renew this, and I have to go back and review the literature and update it. And so
that's brilliant.
The bad news is it's a lot of work, but the good news is imagine how much I learned while I was trying to collect that information.
That is absolutely, and that very fact brings me to my next question very comfortably. You've published almost 60, there are almost 60 plus articles to your name. I'm sure there are more than that. And you've obviously read around 2,200 articles, or probably much more than that. So how has that evidence-based learning and evidence-based clinical practice, which is the dream of any good clinician, my first question is, where did that passion for research come from? And secondly, how has that feeling been of evidence-based dentistry?
Well, the research thing just comes from 2 things. One is just a general curiosity about what the potentials are out there. Another sidelight, when you are in academics, there is some pressure to do research, and even those people that don't like to do research, if they want to be in academics, they kind of have to do it to maintain the position. But for me, it was just all about learning and about growth. And in terms of evidence-based things, if you read a couple hundred articles on a particular subject, if you really understand what is a good scientific protocol, you know, we always talk about double-blinded, randomized, controlled studies. When you look at really good, well-done studies and you can clearly see that one outcome is better than the other, that starts to influence how you change your practice.
Absolutely.
One of the key components there that I always advise everybody is you need to have some background in good research methodology, because there are a lot of things that are published out there where somebody did 15 cases of one thing and 15 using a different technique, and they showed that one was better than the other, but it wasn't double-blinded, it wasn't randomized. They picked 15 patients that they thought would do better with this kind of implant and bone graft, and they picked 15 that they thought would be better with that. And they'd already biased the study. So if you want to really base your practice on evidence-based outcomes, you have to really be able to understand how a scientific project should be put together.
That is absolutely, absolutely beautiful. Because that's the dream of every dentist, to be able to practice evidence-based dentistry. Okay, so moving on to my next question. In today's time, in 2020, what would your advice be to any fresh graduate who is an aspiring maxillofacial surgeon? What should the mindset of a young dentist be right out of graduation?
Well, number one, as I said at the start, I loved so many aspects of dentistry that before you choose a profession, you want to make absolutely sure that that is what you want to do. And if there's any doubt, here in the United States, if a dental student finishes their dental training, but they're not sure about postgraduate training, I encourage them to go do a hospital dentistry 1 more year internship where they see some surgery, they see some periodontics, they do some restorative, they take care of some hospitalized patients that have illnesses and manage their dental needs, and make sure that the area that they want to go into is in fact what they hope it will be. And then, once they start to pursue that, you just have to put your whole heart into it. You have to study, you have to read, you have to really develop a passion for that. And then the last thing I'll say is that whether you're in general dentistry, prosthodontics, oral and maxillofacial surgery, anything, each of those areas have so many different little sub-specialty areas to go into. And as an oral and maxillofacial surgeon, I think it's impossible to do everything. To do trauma, and to do head and neck cancer surgery, and to do implants, and to do orthognathic surgery, and to try to combine all of those. You're not going to be really good at all of them. So I think it's always good to pick 2 or 3 areas and refine your skills, and let your partners or other people in your community do the other things that you don't have time to become good at.
That's beautiful. That is absolutely beautiful. Okay, so this next question, Dr. Tucker, is something that we have to ask every dentist, and especially you, because it's about COVID-19, and you were there when we transformed from during the AIDS, when AIDS became
HIV, exactly.
when HIV became a norm, and you had to go on from practicing without gloves to using gloves and using masks. And so how do you think the world will react to COVID-19, especially dentists? Compare it to the HIV situation and the today COVID-19 situation.
Yeah, I really think that if you stick to the strictest way that we've now tried to maintain our offices in terms of sterility and universal precautions, those things carry right over to COVID. And as I was thinking about answers that I might give to questions that you might ask, that would be my comparison, that this COVID crisis is similar to the HIV.
Absolutely.
And I think that the pathway out will be much the same. They will develop a vaccine. Enough people will develop an immunity. This will take 2 or 3 years probably to get all the way through the crisis, much like HIV, which actually took a little longer than that. But I would say, so we're at 2020. I think in 2023, we'll be back to more normal socialization and life outside of the office will be more like it was 6 months ago. But I think in the office, what the COVID-19 will do is just add one more layer of strictness to all these protocols that we've developed.
Yeah.
When the HIV thing came out and we started the universal precautions, as medicines came out and people were not going to be transmitting the disease, I do think a few people got a little lax. Occasionally, you would examine a patient, you wouldn't put on gloves, you just grab a tongue depressor and look in there, and that stuff will all go away. We'll just get stricter and better at what we've already established.
Absolutely. Okay, so there's this phrase that we like to use here in the subcontinent, and it's that squamous cell carcinoma is the epidemic of the 21st century. It's the upcoming epidemic of the 21st century. What is your opinion on this specific phrase, and what has been your favorite subspecialty in oral and maxillofacial surgery, whether it's been treating head and neck cancer, orthognathic trauma? I know it's orthognathic, but why specifically orthognathic?
Yeah, well, let's go back to the first thing. So squamous cell carcinoma, actually, I think it's human papilloma virus is the issue, and that's something that's going to take a lot of education. We have to get parents to get children vaccinated earlier. Social behaviors aren't going to change that much in terms of sexuality of young people, and so we have to recognize that and make what is available in terms of vaccines for HPV,
absolutely,
very universal. Again, the reason I told you that I loved every aspect of dentistry. I also loved every aspect of oral and maxillofacial surgery. And my early research, if you look back at the papers I published early in academics, I had 3 areas. I did a lot of anesthesia research.
Absolutely.
We were the first dental center in the U.S. to study Versed for dental applications.
Okay.
We were also helped develop Romazicon, the reversal agent. We were the very first center in America to even test that. Third molar patients were perfect. We would slightly overdose them and give half of the patients a placebo and half of them the real thing. And so that was back in kind of the scary days of some research. But anyway, so I loved anesthesia. I was doing a lot of study with orthognathic surgery, but I also did a lot of temporomandibular joint research. I did a lot of surgery on monkeys, primates, with autogenous tissue repair.
Wow.
But as I mentioned, you can't be good at everything. And the fourth thing I didn't do, I haven't published a lot on this, but I was actually the head of the Implant Center at the University of North Carolina when it first started. So I had those 4 areas. But eventually I said, if you want to be good at something, or if you really want to become a world's authority, you should hone on 1 or 2 areas. And when I left academics, people recognized that I had lectured and published so much on orthognathic surgery that they felt like that's what he really likes to do. And so that became my referral pattern. And before long, that's all I did. I did 250 cases a year for 20 plus years. So
because that's what whenever I've Googled you, it says that you've revolutionized orthognathic surgery, and I can clearly see why. 250 surgeries a year, that's huge. Okay, so you've seen dentistry change over the past 50 years. Now, I want to talk about the future. Where do you, regardless of the COVID situation, where do you see dentistry going in the future? What's the future of dentistry in respect of newer technology? Where do you see dentistry going in terms of newer technology?
Yeah.
And what would you like to see happen in dentistry?
Well, computers obviously continue to advance our ability to treatment plan. And
Absolutely.
so I think the precision of everything from the way we do orthognathic surgery to the placement of implants, the way we integrate with prosthetics, orthodontics, all this is so much more computer generated. You know, orthodontists used to put on all the bands or brackets and bend all of the wires. And now they send in an optical scan of the teeth and a cone beam CT scan. And the next thing you know, they get in a little box in their office all the appliances that need to be put on, as well as the wire that goes in them. So a lot of it is by treatment planning. The other thing that I think is going to happen, we already see some, is robotics.
Yeah, absolutely.
There are some companies now that if you ever talk to an engineer, I have a couple of friends that are engineers, and they say, you know what the weakest link is?
Dr. Tucker, I would like to, I'm sorry, I'll have to cut you off over here. I'm really sorry about this. My internet is a bit unstable. I'll just go check it out in a minute and it'll be perfect after that. Is that okay?
You want me to just hold on?
Yeah, just hold on for 30 seconds maximum.
Okay. Yeah.
I'm really sorry. I truly apologize for this.
Yeah, no problem.
Hello.
We good?
Yeah, we're good. We're good now. I'm really sorry about that. Someone did something with the internet. I'm really sorry about that. All right, we can continue off from the second point that you were making.
So where you want to start back at the future?
Yeah, the future, the robotics part.
Yeah. So in addition to the computerized planning and making things more precise, I think robotics will have a role in a lot of different types of surgeries in the future. And if you ever talk to engineers, people that develop machines for making precision parts for anything, they think that by missing by a half a millimeter or a millimeter, that's not tolerable. And so they say, what is the weak link in an implant treatment, or in a case where we're placing 9 implants? The weakness is the surgeon, because we can miss by a millimeter. An engineer thinks that's a horrible thing, and eventually I think robotics and the computer planning will make some of that much better. The other thing is that I think that stem cells will revolutionize the way we treat many different things. You know, there's a woman here. There's a woman here in the United States. Her name is Pam Yellick. She's a molecular biologist at Tufts University in the Department of Orthodontics. And she is taking stem cells and reimplanting them and growing teeth.
Yep. So I've read about that research. Absolutely.
So we might not even have implants 50 years from now. What we might be doing is just taking gingival stem cells, creating dental progenitor stem cells, implanting them in an extraction site, and growing a new tooth.
Yep. So absolutely. That is a possibility. Okay, so sir, this is a question that my team wanted to ask you, and it's about the most unique surgery that you've done. If you could tell us about the most unique or the most difficult surgery that you did in your time.
A couple of different surgeries. the very, very severe obstructive sleep apnea cases that need maxillary advancement, mandibular advancement. We usually take out the turbinates inside their nose. We sometimes even remove tonsils. We create better septal architecture, and those can be very, very difficult surgeries. Probably the most amazing surgery that I did many times, a couple hundred times, is where you take a very, very deformed child, either with class 2 mandibular deficiency, where they have almost no jaw, or class 3. And kids are very cruel to each other. And in April, they're in school and everybody's making fun of them. They get out of school in May. I operate on them in late May or June, and they go back and they look fantastic. And in the fall, people start to call them for a date because they look so good. They look so good. So, and then as I would walk through a park, or I would be in a shopping center, and a parent would come up and hug me and say, 10 years ago, you operated on my daughter and changed her life. And so all those operations, that's what made my career so good. That's
absolutely beautiful. Okay, so we're moving towards the end part of our interview. And so we just want to talk about your achievements. You have so many achievements, sir. So you've authored plenty of books, your research articles, your patients, your students. There's a lot you could be proud of. But if there is one accomplishment that you're the most proud of, what would that accomplishment be?
The people that I've trained and that now practice. I say that it's much like raising children. And I'm obviously very proud of my children as a human being and as a parent. As a surgeon, these people come to me with no training and really don't know anything about surgery. They spend 4 to 6 years with me, and by the time they're finished, I would let them operate on my own family. And so the residents that I've treated and that I have trained and that are now out there treating patients are probably one of my greatest joys. In fact, I sometimes say in a lecture, at the very start of your career, when I was young, my badge of honor was, I would say, I work with Dr. Terry or Dr. White or these people that are very well known.
Absolutely.
And now at the end of my career, I say, I'm the person who helped train Dr. Mark Ox or Dr. Todd Owsley or Dr. Brian Bell.
Beautiful.
And so those are my sources of pride. So
that is absolutely beautiful. Okay, so sir, last question. Firstly, what do you think about this startup of ours, and any advice that you would like to give us? And secondly, if you were ever called for a lecture over here, would you want to come to Pakistan?
Oh, certainly. But what was the first question again?
My first question was, what do you think about this startup of ours in Pakistan, and any advice that you would like to give us?
Oh, I think this is fantastic. It's very interesting that with the Osteoscience Foundation that I work for, we do a webinar series, and we have someone come and do a 1-hour webinar lecture. And then Andrea Boydman, who's the executive director, and myself, we do an interview that's very much like this. I was just smiling at myself when you sent me kind of the outline of how we might talk, because I sent it right to Andrea, and I said, this is the same thing that we've been doing for the past few months. It's almost the same line of questioning. So great minds think alike.
Absolutely. I'm honored that you said that to me. Absolutely. Thank you so much, sir. All right. So thank you so much, sir. It has been an absolute honor talking to you. This is by far one of my favorite interviews that I've done. I feel the utmost pleasure in saying that I interviewed Dr. Tucker. And thank you so much for taking time out for us. It really, really means a lot to me and my team.
Well, it's been a real honor to have this invitation, and it's been a a pleasure talking with you, and I look forward to seeing the final version of this. So
Absolutely.
Good luck with your future endeavors, and let me know if I can help you in any way.
Thank you so much, sir. Take care and stay safe.
All right. Stay